critical hospital data, the state's new focus for determining necessary shutdowns. The numbers here at home keep climbing. Now 517 COVID-19 patients in Western New York hospitals. Still, 27% of beds are available across this region. Hospitals statewide are working to ramp up their capacity by 25%. Administrators met with state officials today to go over their plans. Senior reporter Eileen Buckley goes in depth for a closer look at the state of our local hospital systems.
The problem right now is that we're seeing more patients be admitted quicker than we are seeing people being discharged.
ECMC President and CEO Tom Quattrochi says hospital capacity is at 90%, but as one of the busiest trauma centers, that's not unusual. Right now, there are 60 COVID patients at ECMC, but Quattrochi says he's expecting an increase by the end of this week.
It's just a question, obviously, of how many. We have been consistent between 55 and 60 patients for the last 4 or 5 days.
But Quattrochi says they are ramping up capacity to 25% by orders of the governor.
This is a hospital capacity crisis, and more it's becoming a greater crisis for hospitals as their capacity is further diminished.
Governor Cuomo announced hospitals across the state are managing with what is called a surge and flex program. The state health department commissioner sent this letter to hospitals statewide. It states it is incumbent upon individual hospitals and hospital systems to alert the state to issues and situations prior to the hospital reaching 80% capacity.
The way we're managing capacity, it's like we have a half a dozen water lines and we're adjusting the valves.
Niagara Falls Memorial Medical Center president and CEO Joseph Ruffalo says patient activity is changing hourly. The hospital announced a new COVID-19 antibody outpatient therapy for those who tested positive with symptoms to avoid hospitalization.
The trick is to get them at an early stage when they start feeling ailment.
Kaleida Health also announced it's increasing bed capacity by 25% and is adding additional intensive care beds at its hospitals. Hospital leaders are keeping a close watch on bed capacity and say the good news is drug therapies are shortening hospital stays. But ECMC is also facing staffing issues. 50 employees are out with COVID.
We're trying to redeploy staff. People are taking overtime. We have not had to use agencies on the inpatient floors, so that's another trigger we can pull if we need to.
Eileen joining us live now. Eileen, what about Catholic Health? Last spring, it dedicated St. Joseph Hospital in Cheektowaga for COVID only. Is that happening now?
Not currently. A Catholic Health spokeswoman says right now they still have non-COVID outpatient services being performed at that site. All 5 Catholic Health hospitals, including here at Kenmore Mercy, are currently serving COVID patients. Ashley?
All right, Eileen, thank you for your reporting tonight.